Well, who hasn't enjoyed the unusually warm winter we had this year? But now health officials are reporting an early emergence of ticks in our area. Here to tell us more about Lyme disease and how you can avoid it is Dr. Toni Thompson-Chittams. Glad to have you back.
Thank you very much for having me.
Now, you know, I've read about this, and apparently, it was a year or two ago, Montgomery County really topped the nation with symptoms, even Lyme disease. Is it still there in the numbers?
The numbers are definitely increasing, and there are many opinions of why we're seeing such a sharp rise in the number of cases of Lyme disease. Some believe that perhaps physicians are recognizing it more and reporting it to the CDC, but others believe that our climate has changed, and this makes it more conducive for the deer tick to increase in number, and it carries the bacteria for Lyme disease.
It's all with our crazy weather. Just blame the weather.
Well, that's one point of view.
Now, when we're talking about ticks, let's first identify. I know we have some pictures, and they're not that pretty, but we got to show you about what a tick looks like in the skin. Some people could get a bite and think, "Oh my gosh, what could it be?" But how do we know? And there's a picture right there of a tick. How do we know for sure that that's what's going on with their bodies?
Well, a tick certainly will be attached to the skin.
Right.
I mean, it's certainly going to be attached to the skin. And the ticks that we're certainly most concerned about is the deer tick, the nymph deer tick, because that's highly infectious for the bacteria that causes Lyme disease.
Are you able to identify? Is it easy to identify between the two?
Well, a tick is the lymph, particularly the lymph deer tick, is very small. It's the size of a poppy seed. So sometimes it's very hard to identify.
Tiny.
Very tiny, very tiny.
Let's talk about the symptoms here. Number 1 being fever.
Sure.
Number 2, headache. 3, fatigue. And the last one here is the bullseye skin rash, which I know we have a picture that they're going to pop up here in a second. But it's not like you're going to have all of these at once.
Exactly. You know,
Here's the bullseye.
That's the bullseye. And sometimes kids can just present with that particular bullseye rash, which is called erythema migrans, and it's asymptomatic. Some people don't even have symptoms, but when we see that as health personnel, we know that is so characteristic of Lyme disease.
That's a big telltale sign.
That's
right
a
there.
big telltale sign. And whatever you put on that particular rash, it never goes away.
Now, I've heard of people that, you know, didn't realize they had the bite. Like you said, they could be so tiny. And it's been a while. And if you just have a fever, you think, okay, I've come down with a bug. This could have happened. And it goes on for a while. And bam, they're past the early symptoms point. That's kind of the scary part about this, the Lyme disease in general.
It is. It is. And these ticks, you know, most studies have shown that if these ticks feed 36 hours or more, that increases one's likelihood of contracting the bacteria.
So you just got to keep in mind where you've been. If you've been outside, maybe, I mean, what would you recommend? Checking your clothing to see if there's anything in the socks, or what do you tell your patients?
Exactly. Well, first and foremost, after all outdoor events, everyone should be checked from head to toe, in their scalp, behind their ears, around the neck area, under their arms, certainly their buttocks, and in between their thighs. Really check. And you should also check your pets, because they could carry those ticks
and bring them
into
the house. You think you're safe, and then the dog gets in the bed, and there you go. It's transmitted.
Exactly. And if you're in a dense wooded area, you should wear a hat, light clothing with long sleeves, long pants. Consider tucking those pants inside of your socks, and wear an insect repellent, something that contains at least 30% DEET, because that'll afford you 6 hours of protection.
30% DEET, and is that safe for kids?
Well, the American Academy of Pediatrics recommends if you're going to use an insect repellent that contains DEET, use in lower concentrations, but spray it on their clothes.
Spray it on the clothes,
Spray it on the clothes, and it's not recommended in infants 2 months and under.
Okay, good thing to keep in mind. I want to talk about this. If you have a tick, you see it on your body, should we try to remove it ourselves, or does it go right into the doctor?
Well, absolutely. You could try to remove it. Just take some blunt tweezers, go down to the base of the skin, and apply slow, steady upward traction. Don't twist, don't crush.
Here's some pictures right here on how to do it. I mean, you got the tweezers there, and you just got to get a hold of it. This isn't a pretty process, but you got to get it out of there.
Exactly.
Now, when do you think you need to see a doctor? If your symptoms persist after you've removed that tick, is it possible that even though you've gotten that tick out, that you're going to have some remnants of what was going on before when that tick was in your skin?
Well, absolutely not, because keep in mind that all ticks do not carry the bacteria that causes Lyme disease.
Okay.
So we often say, just watch. You know, if Lyme disease is going to occur, it's 3 to 30 days from that bite of the tick. And again, the first stage of it is that characteristic rash known as erythema migrans.
So just watch yourself. Check yourself out.
Just watch yourself.
When in doubt, talk to somebody like this doctor right here. Doctor, thanks for being here. We appreciate it.
Thank you very much for having me.
Of course. Up next on